The sale of alcohol in South Africa is currently banned. There was that announcement by the President on Sunday night. At the same time, there have been all sorts of claims around how many people are admitted to hospitals as a result of incidents relating to alcohol and how much South Africans actually drink. Government officials, including ministers, have said the reason they're banning alcohol under the state of national disaster regulations is to free up hospital beds. But there is some conversation about the real numbers in all of this. Cayley Clifford is a researcher at the organisation Africa Check. Cayley, good afternoon to you. Thank you for your time. There seems to be a lot of discussion around this. Some ministers have said that we drink almost more than any other nation. From the research that you've done, is that true?
So for numbers on total alcohol consumption in South Africa, we tend to look at what the World Health Organization has to say. They release global reports on the number of people who drink alcohol in countries around the world, and this is for people who are aged 15 and older. And when we have a look at the recent figures, it shows that in 2016, South Africa actually ranked 50th out of 195 countries for total alcohol consumed. So we're not quite up there on the list, but I think what's also important is to consider the consumption habits of those of us who do drink, because that seems to be the bigger issue in South Africa.
Okay, so when you talk about consumption habits, it's easy to look at how much alcohol is sold in South Africa, divide that by around 55 million, and you sort of get a total, I suppose, divided among the number of adults, I should say, which is a little less than that. But we actually do seem to drink in a different way, right? And I mean, we're not the only country. I think Britain drinks in a different way to Russia, for example.
Yeah, I think what's interesting is that when we have a look at the figures, for 2016, we see that almost 70% of South Africans actually abstain from drinking. A majority of these people have never had anything to drink in their entire lives. Some of them have recently quit drinking. But the problem, as I say, is people who do drink and engaging in heavy episodic drinking. And when we look at those figures, we see that we climb right up to 23rd out of 195 countries. 59% of South African drinkers engage in heavy episodic drinking.
Are there numbers that show how many crimes in South Africa are related to alcohol as opposed to in other countries? I mean, can we say definitively that we, for example, drink, I mean, this sounds slightly ridiculous, but drink in a more violent way? In other words, the drinking that we do does lead to more hospital admissions.
Not that I know of, and that was not necessarily the focus of the fact check that we did. What I think was interesting, though, is that when we look at the gender breakdown of those drinking figures, we see that South Africans consume on average 9.3 litres of pure alcohol per person. By gender, 16.2 litres are for men and 2.7 litres are for women. So I think that's also an interesting facet, and one which people, wouldn't ordinarily know unless you sort of dive deeper into some of these figures.
Okay, I mean, that really does show you that's a huge disparity. I mean, men clearly drinking a lot more. I mean, we know, for example, there are plenty of crime statisticians that will tell us how many crimes, how many murders are committed on Friday and Saturday nights as opposed to the rest of the week. But some of the numbers that have been thrown around by government are quite large. I mean, people suggesting essentially that we could save a large number of hospital beds if we just ban alcohol, and that's the rationale that's being given. It does seem there's some justification here, right?
Well, it does. We recently did a fact check on this after Becky Cele, our Minister of Police, claimed that 34,000 hospital beds are currently being taken up by alcohol in our hospitals. And he wasn't able to provide us with much information on where this figure comes from or much evidence for it. But we had to then go on what information was publicly available at the time. And a lot of experts that we spoke to pointed us in the direction of a modelling study that's been done quite recently by 2 trauma surgeons in South Africa and 2 professors at the South African Medical Research Council. And the study's actually still being peer-reviewed, but essentially it looked at how trauma admissions in South African hospitals are decreasing because of the lockdown and how much we can expect to return when alcohol ban was lifted. And I think that those figures really give us quite a clear indication of the levels of trauma that we're seeing in our hospitals, but also specifically alcohol-related trauma admissions, because sometimes those two things are conflated when they're actually not necessarily the same thing.
I suppose this gets to another problem, which is what is the definition of an alcohol-related incident? I can imagine plenty of people actually having quite a big argument about that.
Yeah, and I think it's quite difficult because You would think that alcohol levels of all patients are tested when you walk into a hospital, but this is not the case for a number of reasons. One is that tests are actually quite costly. And number two, you actually need the consent of the patient to test for alcohol levels. So hospitals will only test this if they think that the answer is going to help them make a treatment decision. But even then, by the time that this result comes back, the intoxication may have, worn off. Having said that, though, doctors can easily smell alcohol on the breath of patients. You can see when someone's had something to drink. And so this will obviously determine how cases are managed.
Cayley Clifford, a researcher at Africa Check, really do appreciate the time and the research. Thank you very much.